Hi, everybody. If you're in midlife and you are feeling like the menopausal bearded lady, this show is for you. If you've got the random dark chin hair that you've been plucking out, or if you are full on shaving your face right now, this show is for you. There's a lot of crazy stuff that happens in midlife, but the beard and the mustache and the random hair, that is like literally driving me crazy. So I thought, I've done a show a long time ago about shaving my face. There's a lot of benefit to that, but we're going to talk today about what happens in midlife. Why is it that we start sprouting hair everywhere, and what can we do about it? Because it's not the typical things that you would think. And this is going to lead me right into next week, where I'm doing laser hair removal live on my face. But right now we're going to talk about the midlife bearded lady and why does it happen? So is anybody out there experiencing the same thing? You've got like the random hair, or you go a long time without looking into a magnifying mirror, and then all of a sudden you look in the magnifying mirror and you're like, holy crap. Was this hair here the whole time? Was the peach fuzz there the whole time? If you're in midlife, this is probably happening to you. And if you're not in midlife, yeah. Look what you have coming around the bend. It's so nice. So with menopause and all the 1,000 symptoms of menopause, the random dark hair, chin hairs, or mustache is one that is like, not fun, just absolutely not fun. So why does this happen? I want to talk about that first. And there's a lot of hormonal changes that happen. So as your estrogen declines, we have estrogen and progesterone in our body, as well as testosterone. And so when the estrogen dips and your testosterone, that ratio of estrogen testosterone changes, that can cause hair loss. Christine Kennett said, car tweezers, when yes, it's because randomly, when you get good lighting, all of a sudden it'll be like, whoa, that is different. I want to stop right there, because if you are somebody that is tweezing your hair, I want you to realize that there is a risk to that. And I want to talk about that first, okay? Because it was brought up, I'm going to talk about tweezing. Because listen, it is so satisfying. I know this. Hi, Linda Behrens. I just saw Linda come on here. It is so satisfying to find that rogue hair, and you're like, ding, I'm going to get it. Ding, I'm going to get it, right? It's nose hair. Anybody plucking nose hair out there? Because nose hair grows with age as well. I want to stop you right there, because there is a danger to this that people are not talking about. I'm going to shave my face. We're going to get into it, right? I'm going to do half my face dermaplaned. I'm going to do half my face with a razor. I'm going to show you how to do that without even using soap and water. It's a new thing that I just found. I'm going to talk about dermaflash as well. We're going to talk about a lot of at-home stuff. And then next week, I'm doing it live. I'm doing laser hair removal live on my full face. But before that, if you are somebody who is plucking your nose hairs, plucking your mustache, anywhere from the tip of your nose to the corners of your mouth, please stop. Please don't do that. The reason is, went through a lot of research, and there is dangers to plucking your nose hair or the mustache up at top. And the reason is, now listen, you might have been plucking for years and you never would have this problem. But I'm going to tell you about it, and it might stop you in your tracks. There is what they call the triangle of death. I know. It's like, who comes up with this stuff? Talk about scare tactics, but it's literally, look it up. It's in there. The triangle of death is from the tip of your nose to the corners of your mouth. And anytime that you get an infection in here, whether it's from plucking a nose hair, plucking mustache hair, you run the risk of some serious complications. Here's what happens. That nasal cavity, there's many blood vessels in there, okay? So plucking nose hairs can actually damage those vessels, and it creates bleeding around on that ground, which is anytime that you bleed up here, or you've got that little bit of thing that happens, that damage to that blood vessel that happens, you run the risk of infection. Now think about how close this is to your brain. Your nasal cavity can go straight into your brain, right? All of this is really a very dangerous place to cause infection. And so, yeah, you can do with ingrown hairs. When nose hairs are plucked, it can curl back into the follicle, causing ingrown hairs. These can be painful, red, and prone to infection. There's nothing more satisfying than plucking it out. I get it. But aggressively doing that, or doing it once or twice, is fine. But doing it consistently, you run a much higher risk of damaging that tissue, including the nasal septum and mucous membranes and all kinds of stuff. There's also that psychological excessive plucking, right? And I know, I get it. It's so satisfying. Once you get that hair, you're like, oh my God, there's a dark one. Let me pluck it out. It is so satisfying because when you pluck that, it lights up those pleasure centers. It's very tied to an underlying psychological condition such as trichotillomania. That's where people are excessively plucking their hair. It works the same with tweezers. If you are excessively plucking, there is a psychological thing with that, and there is a reward when you get that hair out. So I want you to pay attention to that. But that triangle of death from the tip of the nose to the corners of the mouth, or the bridge of the nose really to the corners of the mouth, is close to the cavernous sinus. It's a large vein. The cavernous sinus is a large vein that drains from the face. It drains blood from the face and the brain. And if an infection develops there, it could be life-threatening. It's called CST. Could be life-threatening. And what that does is it's like increases your risk of stroke, of a lot of different stuff. And so just if you are one that like that is your thing, you are in the mirror in your car and you're pluck, pluck, pluck. If it's on your lip or in your nose, leave it alone. All right. So let's get back, and I'll touch on that a little bit more, but let's get back to like, why does it happen, right? Whether it's fuzzy all over, whether it's the mustache, the rogue hair, or the chin hairs, it is that the main cause is that unbalance or that shift of balance between your testosterone and your estrogen. So hormonal imbalances with age, of course, increase. That's why we weren't having rogue hairs when we were in our 20s. We had a lot of estrogen, and our estrogen far exceeded our testosterone. So because of that, we weren't getting all of these different hairs. So hormonal imbalances are super important to look at. And the imbalance creates an environment where androgens, that male hormone, have a greater impact on the hair follicle. So menopause, that period of significant hormonal fluctuations with drastic drops in estrogen. Fun, everybody, right? It's the gift that keeps on giving. From brain fog to night sweats to, lots of different stuff. Dry skin, dry eyes. Menopause is just like it's more than just hot flashes, you guys, and inability to sleep. It's very, very complicated and lots of different stuff going on, including because of that shift in testosterone and estrogen balance, we can start sprouting hairs all over the place. So increased sensitivity to androgens. So as women age, their hair follicles become more sensitive to androgens, making it more likely to have facial hair. So there's a lot of different causes for it. Genetics, if your mom had facial hair, if your grandma had facial hair, chances are you're going to be prone to facial hair. So genetics do play a factor in it. There's a lot of other underlying health concerns like PCOS. If you have PCOS, you're going to have, irregular periods, acne, and unwanted hair growth. Adrenal disorders such as Cushing syndrome. So just because you start sprouting hair and you're of a certain age, menopause is not the cause of everything. Stop just saying like, oh, that must be menopause. I'm not going to treat my dry eyes. Oh, that must be menopause. That's like saying that must be menopause. I'm not going to treat bone density. So menopause, yeah, it's encompassing of a lot of different stuff as we age, but we also have to look at underlying conditions, medical conditions that could be affecting it as well. So even weight gain, hormonal imbalances, weight gain, insulin sensitivity, type 2 diabetes, all of these will cause facial hair in women to increase. I know, crazy, right? So it's important not just to think about things like, oh, this must be my hormones, or this must be like the regular rite of passage of aging. That means if I'm old, I'm going to be like, nose hairs and chin hairs and all kinds of different hairs. It's not necessarily the case. And so you really need to look at different types of medical conditions that could be causing that as well. PCOS is one of them. Adrenal disorders, Cushing's disease, ovarian and adrenal tumors can cause excessive hair growth on the face, weight gain, type 2 diabetes, insulin sensitivity, all of these contribute. So now what do we do? First of all, if you are experiencing excessive hair growth on your face and it comes out all at once, like all of a sudden, you didn't have it last week, and now this week or this month, all of a sudden you're sprouting hair everywhere, chances are it's not a quick shift in hormonal imbalance. Chances are it's something you need to talk to your doctor about if it's quick like that. If it's like, oh, you used to have 1 hair, now you've got 3, now all of a sudden there's 5, and now there's 10, that's hormonal. That's usually hormonal. So what do? There's lots of different ways that we can treat hair loss at home, you guys. And I've been doing it. I'm 57, so my God, I think I started shaving my face at like 45 or so. But there's lots of different things you can do. Dermaplaning, that's like when you've got like these kind of scalpel type of devices. I'm going to dermaplane half of my face. You can also, like, gosh, I suggest not doing this because I've cut the shit out of my face before. This is like you can get one of these, you can get anything from Amazon, but this is like literally kind of a surgical scalpel. And what you do is you pull your face a little bit taut and against, in a 45-degree angle, we'll scrape that and it will get rid of, dead skin cells as well as peach fuzz and all kinds of different hair. But it's very important that you know how to use that because one wrong move and all of a sudden you're bleeding. Shaving, which I'm going to do. What I have found in shaving is that the female razors out there are not as good as a good old-fashioned men's razor, partly because we put all of this crap around it. And when you're trying to shave, it becomes very cumbersome to get into the places where our facial contour is, right? Much easier with a men's razor. So I'm going to talk about that. Things like electrolysis. Do you guys remember electrolysis? I think that was back in, 20 years ago or so. And that's where they do electrical impulses in the hair follicle that kill the hair follicle. A professional needs to do that. It zaps it. It literally kills that hair follicle, and that is permanent. It will not come back. Sugaring and waxing. Now, you guys, for sugaring and waxing, if you are somebody that uses a retinoid, or let's say you don't use a retinoid and your skin has just thinned with age, which it does, retinoids are not going to thin your skin, but they are going to make it more sensitive. And so anytime that you do any sort of stripping of something, you run the risk of your skin coming off. And when I say that, I don't say that lightly. I mean, literally. I have had waxing before, and this was a long time ago when I was silly and didn't know what the hell I was doing. Learned a lot since then. But I was doing waxing, and of course I was using retinoids since I was, I want to say 30. Yeah, when I lived in Singapore, I was still using retinoids. When I moved there, I was 26. I was using a retinoid at 26. Way ahead of the game, you guys. But yeah, 26 is when I want to say 25, 26 is when I first started using prescription strength retinoids. And you're supposed to wait, right? Like a week or 2 and not use retinoids before you do any sort of waxing because it will literally take the skin off. And I have had a scabbed mustache, like the hair was bothering me, the peach fuzz at that age. Then I had a scabbed mustache from doing waxing, having waxing done my skin was still fragile from using retinoids. So you got to be very careful about this stuff. Sugaring is the same thing. It's just waxing with less ingredients. It's waxing with using sugar and a bunch of other stuff, but it's still the strip that is going to peel off. So if you're using retinoids, which if you guys have followed my ultimate skincare routine, you know that retinoids are the number one anti-aging skincare ingredient. And so if you're over the age of 30 or 25, when your collagen starts reducing, that's when, you know, incorporating retinoids, whether it's prescription or over the counter, is going to be your best friend. So you got to be careful about doing sugaring or waxing when you're already exfoliating your skin. Okay. Facial hair removal creams. Have you guys seen these? In the old days, it used to be Nair, right? You'd put Nair on, or your legs or whatever, and it would dissolve the hair. Think about what this does when you're putting this on your face. Not what I would recommend. The amount of people that are sensitive to that are really high. The amount of people that get a reaction, super high. And you have to be careful of what you put on, the products that you put on afterwards. The same with a lot of stuff that we're doing. But you have to be careful of what you're putting on afterwards. Remember the epilators? Those things that would literally, you'd put them on your skin or your legs and it would rip the hair out, many at a time from the root. Very painful. People think that microneedling is painful. Nope. Get one of those epilator devices. Then we can talk about pain. That's very painful. You get used to it, but there's a lot of negative things about actually plucking your hair out by the root. And I'm going to get into that. Threading is that old school, like you go to a nail salon or you go to a med spa and they'll offer sometimes threading where they take like 2 pieces of thread. You have to be very talented to do it. I don't know how to do it. But you take the 2 pieces of thread and it literally will take all of your baby fuzz. You can do around your eyebrows, all of the fuzz off. It's hard to get the thicker, blacker, darker hair that comes with menopause and comes with midlife. But all that peach fuzz, right, is really beneficial to get rid of, or really effective with threading. Again, it's an old school technique. It uses that teeny tiny threads to pluck your hair out. But now let's talk about plucking. I'm gonna give you guys a warning about plucking. We already talked about that triangle of death, and I'd rather you guys remember that so that you don't do it again. That triangle of death, it's literally a term. From the bridge of your nose to the corners of your mouth. This is the no plucking zone. If you guys want to take that risk of infection that can literally go to your brain, or blood clots, if you're plucking your nose hairs and you have our tendency to have a blood clot, that is such a close distance to having things like a stroke. And that what we talked about earlier, that cavernous sinus thrombosis, that CST, that is one of the risks of CST, is blood clots and strokes. So do you think that like plucking your nose hair can potentially cause a stroke? It can. It absolutely can. That's not a risk that I'm wanting to take. So I no longer pluck anything out of my nose. I no longer pluck anything on my upper lip. You want to pluck a chin hair down here or your eyebrows, you're out of that triangle of death. Okay, so feel free, go for it. But there's other risks of plucking. So hold on one second. Let me see if I can find that. One of them is when you're plucking, and I used to, a long time ago, I used to pluck like down here by on the inside of my calf, where I had like darker hair. My hair on my body is basically blonde, very light, but I would pluck those darker brown hairs on the inside of my calves, and I'm going to tell you right now, it can lead to scarring. How does plucking cause a blood clot? So remember, like when you're plucking, most of the time you're supposed to be plucking like towards the hair growth, right? So you wouldn't pluck against it. That would break it off. But towards that hair growth, there is a lot of damage that can be done by pulling out the entire hair shaft at one time. And what they have found is that when you're doing that in this particular area, not on the rest of your body, but in this particular area, is particularly susceptible to blood clots, especially the lining, the inner part of your nose, down in here, up in your nostrils, particularly prone to damaging that hair follicle shaft, that where that hair follicle is actually being produced, and can actually cause blood clots. And then you've got this very short distance. You know, your nasal cavity is connected. It's all connected. Even your eyes are literally an extension of your brain. So it's the part of our brain that we actually see is our eyes. Now, it's not going to cause a blood clot to go to your brain when you're way up here, but there is a potential. You can look it up. Marissa D said, "Oh my, I always pluck those little nose hairs. Hurts so bad. I won't anymore. If anything else, if this live show does anything else, just stop doing that." Because you know what? When you pluck and you're continuing to pluck, the older you get, the more susceptible you are to those kind of infections that can, think about this. The part that we are the most susceptible for infection on the whole body. Your nose is already filtering out the air that you're breathing in. That's why we have the nose hairs in the first place, right? Is to filter that out. Then you're plucking them out. All of the bacteria that has been accumulated in the nostrils of your hair, of your nose hairs, is susceptible to then that opened skin. When you pluck a nose, your hair is inside your skin. I wish I would have brought a diagram of that. That's why when you have issues with hair loss, you're not going to see your hairdresser. You're going to see a dermatologist, because the hair shaft itself, the bulb, all of that genetic material, all of that stem cell is underneath the skin. You're plucking that out underneath the skin in a place where you have the most bacteria of your whole entire body. So you run the risk of a bacterial infection, and then you are so close to where that is open to the brain, and you can get infections in the brain. You can get a lot of different stuff. So remember that cavernous sinus, that is that large vein that drains blood from the face and from the brain. So you're messing around with that. Joby Bo says, "I rarely do, but my husband plucks nose all the time. I will tell him to stop." Get one of those little things that you insert into your nose. Not this. A nose trimmer that goes, you can buy them at any CVS, Rite Aid, Walgreens, Amazon. They're not that expensive. You need to cut, not pluck. Cut, not pluck. Electric nose trimmer, that's great, but he doesn't pull them. Yeah. My husband has an electric nose hair trimmer, just trims, doesn't pull the hair out. That's great. That's what you want them to do. You know what's also funny? Because you'll see that as you get older, women's hair grows more as well in the nose. And so, and a longer growth life as well. So the interesting thing is, if you want your husband to not have to continually do that, it is the right time to do a permanent hair removal of the nostril is when that hair is still dark. So think about that. When men get older, their hair turns white. They sprout hair out of their ears. They sprout more hair out of their nostrils. This is a typical male thing that happens when they get older. In order to, like, you can have your husband trim all, forever, and that's fine until they get to about 80 or 90, and then they're like, fuck it, just let it grow, and then you'll be on them. But the other way is to do laser hair removal when the hair is still dark, and then you don't have to ever worry about it again. So yeah, I think we're going to pick up one of those. Great. Okay, so there's a lot of negative things that can happen when you pluck the hair. Even when you're plucking the hair like down here, yeah, you don't have as much of a risk of any sort of infection. But when you do that, you have the potential, because you're doing that over and over and over again, to create a little dot of a scar where that hair follicle used to be. So you have to make that, that consideration. Is it that much of a psychological boost to get that hair? Oh my God, yeah. I haven't looked in a magnifying mirror for a long time. I'm going to tell you right now, I see 3 that would be so satisfying to pluck. But if I do that, I run the risk of creating what looks like a pore, because it is, but what looks like a pore without the hair follicle in there. That can lead to, you've got these little, looks like an uneven skin tone and texture, right? Because you've got these little things. There's no way I'm gonna be able to say that handle. I pluck every 3 to 4 weeks. I get really close and get the root too. That's what I'm telling you is not a great thing to do. You do run the risk, especially in darker skin tones, to scar that area. It might not happen the first time. It might happen the 50th time. But when that hair follicle does not grow back, first of all, you run the risk of ingrown hairs because you're pulling it out. Every time that you do that, you run the risk of that hair growing in a curve, right? And when it does that and the skin grows over the top of it, you've got, hello, ingrown hair. So then you've got to try to get that out. This can lead to scarring. It really can. And I don't say that lightly. It's happened to me on a little portion of my leg. Now, I get a magnifying glass to do it. It was a long time ago, but I don't think you want that on your face. I don't think you want that on your face. MyJav4 said, I use Braun at home laser removal device for underarms and bikini. How do you like that? Let me know how you like it, because there are a lot of at-home laser hair removal devices. They're not cheap. They're like $500. So you have to think about, okay, if laser hair removal for my full face is $100 per treatment, which it is, I looked because I have an appointment next Saturday at 12 o'clock. I'm bringing you guys along with me. You'll get to see laser hair removal of a full face of a woman in an office. That's what we're doing next week at 12 o'clock on Instagram Live. But that said, that is $100 a treatment. Now, they say it takes 3 to 6 treatments for it to be permanent. I did probably 3 to 6 treatments on my underarms 20 plus years ago. I have not shaved my underarms in 20 plus years. So there is a benefit to doing these at-home or in-office laser hair removals, but you have to weigh the cost. If the device at home is $500 and I'm going to be doing this all the time versus going into some place and spending $100 each treatment and I'm doing 6 of them, what's the balance there, right? So it's all dependent on you. Some people love to, I'm one to talk. Some people love to do these at-home devices. Yes, I love doing at-home devices, but I also don't like having to look in a magnifying mirror every day at my face. And I don't like once I get done with an event or I get home or whatever, and then I'm, decide like, oh, I want to pluck my eyebrows. And I'm like, holy crap, has that been there the whole time? I don't like that. So that's why I'm doing that next week. Plus, I want to show you guys what exactly it is like to get laser hair removal of your full face. But I want to say that in terms of there's a lot of people that say laser hair removal is not permanent and does not come back on my underarms. I have not shaved I can't even remember the last time I shaved. So there are things that are permanent that are worth spending the money to do in office. And then there's things that's like, you know what? I just want to do this at home. There's a lot of people that just I'm just going to shave. Joe Bebo said, yes, I have those. Just bought the laser removal for home and just used it once so far. And it was in Europe. And as I was in Europe after, a friend says they can induce skin cancer. Never heard of that risk. Never heard of that. I've never heard of that. It's not UV light. I've never heard of laser hair removal increasing the risk of cancer. I've never heard of that. I have heard of IPL when you're getting rid of sunspots or you're going into a dermatologist and getting stuff taken off before, or you're doing stuff like at home IPL that lifts sunspots. and there could be a potential for a skin cancer that you're not getting treated by a dermatologist, I always recommend you guys go and see your dermatologist at least once a year. Full body, strip down, full body, check me all over the place for moles. What has changed? What hasn't? What looks funny? Because what you don't want to do is like have like a basal cell carcinoma where they have got to dig and dig and dig until they get a clean slab, right? Once a year. I always do this around my birthday. When my birthday comes up in April, I'm like, oh, got to get to the dermatologist and check everything. Now, if you're prone to skin cancer, then that's different. You need to go in a lot more. But I've never heard of laser hair removal increasing cancer risk. So I would be okay with that, Joe Bibo. But again, you have to be your own advocate. You have to look this stuff up before. You need to ask your doctors. Okay, I'm gonna shave. I want to show you various things that I like. I do not like to shave my face with a women's razor. And I said this earlier. Think about like, how can you get, I'm not like shaving, but how can you get like around this area when you've got like all of this cushiony stuff that's supposed to add moisture and all of that? It's really difficult to do. So I like a man's razor, and I like to use, this is something new that I started using. This is Hanny. It's a shave pillow. It's basically, you put this on. It's like the consistency, I wish I could show you. It's kind of the consistency of a balm, but it feels a little bit wet. So when you do this and then you do a razor over the top, you get like a real, like, did you guys just hear that? I hope you heard that. Let me do that again. Right? That's shaving. That's like, and no rinsing. When you get done with this, you just rub it in. I have no affiliation, but I do like this because especially when I'm showing people, it's difficult for me to like, oh, let me go wash all this shaving cream off. And you don't need to be in the shower. You don't need to be like around water. This just soaks back into your skin afterwards. So I do like this. I'm going to shave half my face, but I do want to talk about things like the Dermaflash. So anytime that we're doing, before I do that, let me just talk about the benefits of shaving. Do you ever like secretly loathe your husband because he looks younger from here down than you do? I do. Only because I know why men tend to look younger down here than women, because they have shaved their entire life. So think about what this does. It helps to exfoliate, right? So it exfoliates not only the hair, not only gets rid of the hair, but it exfoliates dead skin cells. So it removes dead skin cells. It can brighten the complexion and promote more cell turnover. So that is a big benefit of shaving. Smoother skin. It smooths fine lines. It gets rid of that peach fuzz. It gets you smoother skin, and it gets a nicer canvas, smooth canvas, so that when you put on your makeup goes on smoother. Better skincare absorption, right? If you've gotten rid of that fuzz, you've gotten rid of those dead skin cells from shaving, it helps your skincare absorb better. Anti-aging effects. Okay, so it can stimulate anytime that you're taking a razor to your face, whether it's or anytime you're taking anything to your face that is sharp and with the potential of, getting rid of dead skin cells. Microneedling is the extreme version of that, which I do, every single month or every single Sunday, but to my face every month. But it does help with that cell turnover and reduces the appearance of fine lines and wrinkles. I know. That's why men tend to, when you see your man without a beard, or you see your dad, or you see your brother, or whatever, they tend to age less on the lower part of their face than women do. So there's a lot to be said about doing that. Now, there's drawbacks as well to shaving. Irritation, ingrown hairs. Shaving can sometimes lead to redness, ingrown hairs, especially if done incorrectly. You'll see men sometimes shave up. That's not how I shave. I always shave down. I don't need to get the closest Gillette 3 things, shave in there, because my hair is not the same as like a man's beard. So shaving down, you're going to have a lot less irritation than if you were shaving up. Okay, so dermaplaning, I want to get into that. Dermaplaning is basically these little things, I got this from Sephora, right? There are these little razors. And the way that you dermaplane is that you hold your skin taut. So you don't want to just let it sag. Hold it taut and go at a 45-degree angle. I'm going to show you right here. 45-degree angle on dry skin. Now I can see, ooh, look. Do you see that? I did right here. That is from me not wanting to shave with this close to my hairline. But if I'm doing it with a derma razor like this, I can get close and right up to my eyebrow. So this is all sterile. So I can do this right. You ever like look in a magnifying mirror and you've got your eyebrow that's defined and then you've got all this peach fuzz up above. So doing this and getting right up to that eyebrow, if I were to hold this without holding my skin taut, you have more of a chance of cutting yourself. If I were to hold this without holding my skin taut, I'm going to have less of a result. If I move this razor at any angle other than a 45-degree angle or less, more parallel to the skin, you run the risk of cutting yourself. And I'm telling you, I've cut the heck out of my skin over here because that's a difficult place to get to. So I'm going to show you half of my face with this. Short strokes. I can see the fuzz. What I've also done is held a popsicle stick right here so I make sure that I don't hit my eyebrow. But I'm going to do half of my face with this. Now this you have to do dry. So what you're seeing is not only peach fuzz, but it's also dead skin cells. Can you hear it? Let me see if you can see that. Let me see if I have, maybe it'll show up a little bit better on here. I don't know if you can see it, but there's a lot of fuzz. I got a lot, oh, there we go. There's a lot of fuzz there. Okay, so I'm going to keep going. For those subscribers to the Live Young subscription club, that's that club that's $4.99. Our group chat just ended. So today, after my live show, I am going to open up another group chat where you can ask me questions about anything. And I am going to post this to that exclusive content. That's that $4.99 a month club, you guys, where it has all of my tutorials for microneedling, for red light therapy, microcurrent, radio frequency, all the at-home stuff that I do. Notice how I'm still holding my skin taut. I want to make sure I don't have any questions. Oh, wow, you do the epilate. So you do that that thing that pulls it out at the roots. Okay, just make sure that you're not seeing those hair follicles, that bulb that's like going to leave that little dot that's going to be a scar, because that's what happened to me. I'm considering laser hair removal for bikini. I did that. Love it. Joe B. Bobe said, I've never had either, so I'm surprised. It surprised me that she warned me. I have those divots and pores on my chin from plucking. So glad I can use the, yeah, you can have, you guys, plucking over and over and over again. You're not going to get it with the first one. There's a reason why they come back. And plucking can actually stimulate, that act of plucking can actually stimulate those stem cells in that root bulb and cause more hair to grow. You think that by plucking, oh, if I pluck it and I get it by the root, it's going to come in less. Sometimes that's true. And sometimes it comes in more. And sometimes it leaves a little bit of a divot or a scar. So you want to you want to choose your hair removal wisely, depending on what you're dealing with and what your skin type is. For example, laser hair removal, whether it's at home or in an office, only really works successfully on fair to medium skinned people with darker hair. It's not going to do a lot for my peach fuzz. It will do some for the darker hairs that I have in here and the ones on my chin. It's not going to take all this peach fuzz away. Now they've gotten a lot better with in-office laser hair removal, and we're going to find out more on Saturday when I do it live and bring you all along with me. Do you put, so Izzy says, do you put it on dry or put oil first? Are you talking about with this? This is dry. You want a Dermaplane to be dry. And listen, you can use a Dermaplane like this. These come in a pack. They're like 15 bucks. This is like Sephora. Do not keep this forever. If your Dermaplane looks like this, see that? Don't use that. I specifically kept this so you can see that's disgusting. You only want to use them if you're doing your full face. It's best to just do it once, but you can do it a couple of times if you're doing your full face. If you're spot treating 5 to 10 times and then throw the sucker away, woo, that just like literally let all that peach fuzz go. When you're doing a Dermaplane, a Dermaflash, these are like the vibrating ones, right? Those sonic kind of vibrations that, that's a Dermaflash. And so when you get done with this, you pop the thing off and change the blade. This works about the same as one of these, but I find this to be a little bit closer of a shave, more so like a regular razor, because you're going to see, you get the best shave from a regular razor. But these are nice in that, you won't get cut as much, and it will get all of those, so you can hear it. It will get all of that peach fuzz off. This is by Dermaflash. I don't know if you can see that, but there's a bunch of little baby hairs in there. I like this too because I've got like blonde hair, like these blonde fuzzy things all over my skin. You guys, it's not just when you're doing hormone replacement therapy or you're using certain medications like minoxidil for hair growth, it will cause hair to grow all over your body. Now, you're not going to be a bear, we're women, but it will cause peach fuzz. And so I like that kind of thing for that. But for the sake of like just consistency, I want to keep going with my little razor. Sorry, you guys, I have to concentrate. So how you exfoliate really, or how you get rid of your facial hair with age really depends on what is the best thing for your skin and what kind of skin type do you have, right? There's a lot of people that can't use things like a dry Dermaplane like this because it will cause them to have a rash. I can get right underneath that eye too. This will help you guys, all of the makeup to go on, which all of the makeup, I barely ever use makeup, but it helps your makeup to go on a lot smoother. Again, I'm staying at a 45-degree angle and I can hear it. Now, I want to show you, look at that, listen to that. Ugh. Okay, hold on one second. I just want to move this up so I don't miss anything. I do Dermaplane metal one, but I do spray before. It's not as effective if you spray it before. I actually tried it once with this. It's not quite as effective because you want that dry flakiness of the skin cells. Remember, I've talked about this before when I've done chemical peels. What a chemical peel does is the dead skin cells on top, there's a bond that connects them all, and it loosens that bond. When you're doing like a Dermaplane like this, you want that to be dry so it can slough off a little bit easier. So I'm going to just keep going right here. And I want to show you. When I get to here, I put my tongue there a little bit. This part is what I want to show you. So right now my face feels very smooth. I would be very, I wouldn't really put on a vitamin C or anything like that. I would just let my skin breathe for a while. But this is the part that is very easy to miss and very easy to get cut. And you need to use your fingers, your hands, to pull this skin here. How would you, it's very difficult to shave on this jawbone, right? But if you pull this up, that skin that had the peach fuzz on it that was right on the edge is now on a flat surface. And then you can get that all off. Yeah, that's so satisfying. I don't know if you guys can see that. Let me see if I can get it more on a surface like that. I don't know if you can see that, but man, it's satisfying. There's like blonde fuzz like going everywhere. I want to get underneath this eye. Even things like using Latisse, which I don't use anymore because I'm on minoxidil, which causes your eyelashes and stuff to grow as well. But even things like Latisse will have little baby hairs grow underneath your eyes. I want to get right here. And then I'm going to show you the other side with a razor. I have before tried to get in that nostril with this because I stopped plucking. It's difficult. You don't want to do it until you are done, because you don't want to like put this in your nose and then spread it around your face. Like, we got to use a little bit of logic here, right? So when you do the area, which is that death triangle, which I talked about, right, where you do not want to pluck, you need to be very careful in terms of contamination or spreading any sort of infection that could happen. I want to see how I got that. Okay, hold on 1 second, you guys. I'm going back in. Yes, so satisfying. Okay, I'm going to do the other side with a regular razor. That feels really good. That feels, oh, another thing I wanted to do. Is anybody having this, or is it just me? Let's see. Is anybody having like fuzz on your ears that you never used to have? Beauty Travel said, I see a lot of women use oil first, then dermaplane. The tool glides easier, personal preference. I'm sure that's a personal preference. I personally have found that I don't know. To me, it's more satisfying to see like the little fuzz. I know what I'm getting. I know what edges I've done. It's hard sometimes when your face is filled with oil for you to see where that peach fuzz is, right? Because anytime you put oil on your face, you're kind of limiting your vision in terms of being able to see what you've done and what you haven't. So that's my personal preference. I also feel that by doing it dry, there might be a little bit more irritation, but also by doing it dry with a very sterile device, you're not adding the irritation or any potential skincare that could cause infections, you know, unless you're getting your oil and you're pumping it directly on your face and you're not touching it. And, you know, there's lots of different things when you add different skincare to something like microneedling or dermaplaning or anything like that that can then increase your rate of infection. So it is a personal preference, but if I'm thinking about it as a safety point of view, I would do it without oil. That's just for me. That is not going to dry. It's effectively best to do it on dry skin. That's exactly what I said. Yeah, it's not going to remove the dry skin as effectively. Good. A texture, no way I'm going to say that. I always thought if you shaved your facial hair thicker, it would make thicker hair to grow out. It does not. Let me explain that. When you shave your hair, so the beginning of a shaft, let's say you plucked it, and now you've got a baby hair growing out with a thin tip on it, and it's growing out. When you shave it, it does not cause your hair to grow back thicker. It blunts the end of that hair, so you might be able to feel it more. It might feel like a thicker hair is grown out, but all you've done is chop the end off of it. You're not increasing the rate of your hair growing. Does that make sense? That was a good question, though. Okay, let me get to the bottom. I'm going to get to the bottom here. 1 second. Okay. Now, I'm going to do this side with this razor. So, I can feel the difference. I don't know if you guys could hear the difference, but start with a very small section, and I go down. Again, we do not need to go up. When you go up, you increase your rate of hair that's going to be ingrown. You increase the, yeah, you might get a tiny bit closer, but you increase infection rate, you increase irritation, all of that stuff. So as a woman who doesn't have a full beard, I know that this Instagram live was called the Midlife Bearded Lady, but you know, we're not in a circus, so we might not have a full beard, but I like to go down because it's softer on the skin. Okay, and then you do this a little bit at a time. You don't want it to dry out. And then you can do the same thing here. Pull this up. Zippy said, for craft's sake, bikini took me only 2 times. Very effective. Didn't like the legs. It left the skin tight. Wonder if there was nerve damage even decades later. I don't know about that. But for me as well, it's like it was very quick. It's like the lighter skin you have and the darker hair you have, that's going to be the most effective for laser hair removal by far. Yeah, I don't know about the nerve damage. I never heard about that before. That feels so good. Okay, I'm going to do this side on the face. Yeah, you do your whole face, not just where the beard is. Ah. First time my husband saw me doing this, he was like, what are you doing? I'm like, you don't need to know everything behind the curtain. Anybody like ever wait for their husband to be out of the bathroom and it's like, I'm going to totally shave my face. These days it's like, I don't care. But he was a little shocked. And I said, I know, menopause, you know, midlife. It's just that gift that keeps on giving. Now, when I think about doing this stuff, it's the same reason why I have permanent eyeliner. I can imagine, oh my God. Yeah, Zippy says, yes, brunette. For Craft said add 14 treatments for bikini. Wow, that's a lot of treatments for Craft's sake. I think I did maybe 5, and then I would go in once a year, just for upkeep. And now I haven't been back in the longest time, but we're going in on Saturday. Okay, I forgot what I was in the middle of saying, but yeah, mine's been a long time since hair grew back, but I've never done anything on my face in terms of laser hair removal, so I'm excited. You'll see that this is going to be a lot more difficult to get around the eyebrow than something like the Dermaflash and like the regular straight Dermaplanes. So it's very kind of a little bit more risky to do up here on your forehead, but I've got little baby hairs that shine in the sunlight, so I'm going to get as close as I can without risking. See, that's really even hard to do. Now I've got that little bit of oil on my skin. I'm still going to go back over the top of it with this. And yeah, you'll see that it still does work, but it's just not going to be as effective as if you did it dry. But again, personal preference. See, I'm hearing the little cutting of the hair more than I did when I was doing the razor up there, because it's harder to get in that space. Okay, so then this can just be rubbed in. I love it. Oh my God, it feels so much better. Okay, so if I were to compare the two sides, it's really hard to tell because this one has the cream on it. But my God, it's the razor side for sure. Yeah. If I was just to compare the chin. Let me see if I have any more over here. Yeah, I mean, you're looking at a single razor, a single blade versus 4, 5. So of course the razor is going to be more effective. You're getting it multiple times in one stroke. This side of my face feels great. This side of my face feels great as well, but just not quite as shaved. I try to get right down there again. Hold on one second. Hold on one second, you guys. What did I do? Oh my God, it's right in front of me. I still need my mushroom coffee. I try to get right between my eyes. Okay, so I'm going to post this to my subscription club just because I haven't posted there in a while. Next week, I will still post this. If you belong to the newsletter that comes out every Tuesday, I'm a little bit behind because I had an assistant that quit. So I'm a little bit behind. This Tuesday is coming out the creatine live that I did, so that will be in the newsletter. It doesn't cost anything, you guys. Just go to liveyounglifestyle.com and you can sign up for the newsletter. Check your spam, make sure it doesn't go there. But every Tuesday is like a recap. You'll get this live show so you can watch it at super speed. And it's a recap of like my notes. We'll talk about that triangle of death, right? Not to pluck, not to pluck. And that only comes out on Tuesday. I don't bombard you with a bunch of stuff. I never sell your information. I can't believe people actually do that. But yeah, so if you want to get this live show quicker than the newsletter, you can sign up for the Instagram club, which is $4.99. And that's where all of those tutorials live with microneedling. I've microneedled just about every body part on that subscription club exclusive content. But yeah, so I'm going to post this there and then I'll start a new club chat for those subscribers because that ends every, I want to say it used to end every 30 days. And I think now it ends every 90 days. So it just ended. So I'll start a new group chat. You can ask away. I usually answer questions within 24 hours. I don't know where I was grabbing that from. Usually 24 to 48 hours, but usually 24, I can get to every single question. And again, that is like $4.99. But what I have people do is join that club, learn how to microneedle at home, learn how to do radio frequency at home, learn how to face shave at home, learn all this stuff, and then unsubscribe. Learn what you need to do. So Zippy says, I have some strays on legs, but it's manageable to shave. My skin would bleed before, laser around 2020. Wow, 2002. Wow. Okay. Interesting. Okay. Wow. Okay. Somebody asked what this was. This was by Hani. I'm not an affiliate of them, but it is called Shave Pillow. And I kid you not, it is a way to shave without having to do water, without having to do shaving cream, anything like that. You just have to use it in such a way that you're putting it on one section at a time. You don't want to put it on your whole face because it will dry. So you want to put it on one section at a time. It feels like water almost when you put it on, like a moisturizing water. And the good thing about it is after you shave, you don't have to wash your face. You literally just pat it back in. So I love that. Okay. Anything else, you guys? We're right at 1 o'clock. Wow, this time I actually finished on time. I am going to be posting this, like I said, to my subscription club. And if you belong to the newsletter, you will get that as well in your inbox in, I want to say, a week from Tuesday, although we're a little bit behind. So this Tuesday is going to be the newsletter for creatine and the risks of creatine. Remember, my hair started falling out when I was using creatine, and my blood work came back as my DHT levels were elevated. And creatine does have the potential for people who experience hair loss to raise your DHT levels, and that will increase hair loss. So I noticed my hair started falling out, went in for blood work, and my doctor was like, your DHT is through the roof. So that newsletter is coming out on Tuesday about creatine, the good, the bad, the ugly, what you need to be aware of. And then the week after that is going to be on Sugar Sponge. So Sugar Sponge is that new supplement that I just came out with that acts as a post-meal glucose spike inhibitor. Next level. So that is coming out the week after, and then will be this. So I'm a tiny bit behind on my newsletter, but you can always find the latest stuff on the Instagram club. And yeah, any questions, let me know. There's also a free, club, not club, but it's like a free, my God, I can't even think of the word. Like chat. It's a free chat called Live Young Insiders. So if you have any questions from this live show and you want to hop over there, it's absolutely free to join. And I get to it after I get to all of the subscription clubs. Okay, everybody. Have a great rest of your Saturday. I know you have many places where you can be on Saturday. I appreciate the fact that you tune in. and that you learn and that you're sharing this with other people. I love that. From the bottom of my heart, I thank you so much. I love you. I will see you next Saturday where we do laser hair removal live of my full face. It's part 2 of the Midlife Bearded Lady. Okay. Bye, everybody. Bye for craft's sake. Have a great rest of your day.